Men at Work is our artist of the day. This one, Dr. Heckle and Mr. Jive, hit 36 in 1985.
All right. And with that, let's get to our weekly SOS house call. Please be joined now by Dr. Todd Battaglia, specializing in sports medicine, knee and shoulder arthroscopy, cartilage restoration and transplantation, and complex knee and shoulder reconstruction. Dr. Todd, thanks so much for coming on. How are you today?
I'm doing great. How you guys doing?
We're doing great, and we pay attention when you guys come on.
That's
and
right.
We learned something. We learned what Shohei Ohtani's injury was when we saw the term was subluxation. Am I saying
Yes.
that right? Paulie and I both texted each other. We're like, we know that from the SOS house call. So remind people what Shohei is dealing with his shoulder.
Yeah, so subluxation, which you said correctly, is basically what you can think of as a partial dislocation. The ball slid out of the socket but didn't stay there. He didn't have to have somebody else reduce it or yank it back into place. It was just a quick in and out of it on its own. So it's kind of like a minor dislocation.
So he's been wearing this heating device ever since. Can you kind of explain what that is? And I'm sure he's doing this at the advice of his trainers and team doctors and so on and so forth. What does that device do for this particular injury? How does it help?
That's a good question. I don't know if there's a real scientific answer for that. In theory, it's probably keeping his joint a little looser, keeping it from tightening up. May increase some blood flow to help healing, but really it's more just a pain management thing, trying to keep him comfortable.
We saw Texans wideout Stephon Diggs injure himself in this latest game. He's out for the rest of the season with a torn ACL, and it was really a non-contact thing. He caught the ball. He was looking to make a cut, and he ends up injuring his knee, and he again out for the rest of the year. We see this a lot, right, with ACLs and Achilles tendons in particular. A lot of them are non-contact. Is there any rhyme or reason to that? Why we see so many serious lower body injuries that occur without taking an actual hit?
Yeah, I mean, those two you mentioned, ACL and Achilles, they are both much more commonly non-contact than contact. And they're really just related to the ligament or the tendon, depending on which one you're talking about, getting that sudden strain from an awkward movement, an awkward twisting position. I don't know the exact stats, but a great majority of ACL tears are non-contact than contact. And any of us who have done this for a while, I mean, a couple of years ago, we had a poor SU football player who tore his ACL in warm-ups. We've had guys tear their ACL celebrating touchdowns. I mean, those kind of things are heartbreaking when it doesn't even happen in the heat of battle.
And along those lines, that kind of leads me to my next question. We saw first on College Game Day over the weekend, this past weekend, at Indiana, where a fan, came out to get ready for that $100,000 kick, with Pat McAfee and crew, and injured himself while he was warming up, and McAfee says it was a torn ACL. I was going to ask you, is that because he's a non-athlete and not used to that, or it sounds like it can happen to anybody?
It can happen to anybody. I mean, certainly sheer numbers, a lot more ACL tears happen in athletes, during practice, during games. But somebody like that who maybe is not in the best shape, doesn't have the best lower extremity strength, balance and alignment issues play a role to go out there and just try to suddenly do something at a much higher level than he normally does. And that's what you get. I hope Game Day's paying for his surgery.
Yeah, right. Exactly. Let's hope so. All right, let's go to the NBA. Clippers forward Kawhi Leonard still has not played this season. He's dealing with inflammation in his right knee, and he said it likely will impact him for the rest of his career. He suffered that torn ACL in 2021, and he's had some sort of injury to that same knee every season since. And, he's been doing different procedures and so on and so forth in the off season. But he's still not healthy and maybe will never be 100% healthy. Why does this particular injury, why does a torn ACL, tend to cause other issues, later on in athletes' careers? And is there anything that can be done for somebody like Kawhi Leonard who, wants to get back to 100%, wants to play for several more years?
Right. Yeah. So my guess would be that it's not actually the ACL or the meniscus itself anymore, because those are things that are relatively straightforward to fix and make good as new. So what he likely has is some other issues that happened with the ACL injury. My bet is he's got some cartilage damage or a little bit of early arthritis or something for which there's not really an easy fix. So he's going to probably live on anti-inflammatories and the occasional cortisone or other shot. There are some surgeries that can be done to try to repair joint cartilage, but they're pretty big and have very long recovery levels for somebody at his status. There's no real guarantee he'll get back to playing at that level, so he may just be living with this, as you said, and managing as best he can.
One storyline that we keep seeing popping up in college football as it relates to injury, some coaches have been called out for having their players fake injuries to stop the clock, especially in the fourth quarter. Do you think anything can be done to stop this tactic? Do you think anything should be done to stop the tactic? Maybe putting in a rule where you got to sit out a certain amount of plays or a certain amount of time, other than just the one snap to try and deter, this course of action.
Yeah, it is an issue, and any of us who watch or cover sports, we know anything from faking serious injuries to just cramping at the end of games to get your team a timeout. It's really hard to police because you don't want to miss an actual injury, so you got to sort of pay attention to everything. But on the other hand, if you do something like you said, which makes sense, maybe you got to sit out a series or whatever. Maybe you're encouraging kids to not report their injuries or not tell you when something's hurting or go down when they're supposed to. So it's a really tough situation. I don't know that I've got a good answer to it. You get rid of taking dives, and what happens to soccer?
Yeah, right.
Will take 20 minutes. We'll be done.
Right. Very true. Yeah, it may create other issues. I got one more for you that I'm just curious to get your opinion on this. I'm a Bills fan, as everybody knows. Bills Dolphins this weekend, and Tua's coming back, and he's had 3 diagnosed concussions, and seems like 3 pretty serious concussions. What do you think about him coming back, and what do you think about the NFL, not stepping in, not having any say in the decision, just leaving it up to Tua and the team doctors? Are you concerned at all, I guess, for this young man's health?
Yeah, I mean, there is no doubt that the more concussions he gets, the more serious each subsequent one becomes, and that he's going to be at a higher risk for this traumatic encephalopathy that everybody knows. The question is, when you get to that level, and that's how he makes his living, how much of it is up to the doctor, how much of it is up to the player and saying, hey, I accept the risk. It's a really, really tough thing, and the criteria have shifted too. So, 10 years ago, it was sort of automatic. Three concussions, you were done. At least at the college level, that's how we went. And even that pendulum has swung a little bit, and people argue now it depends on the severity of the concussions and how long your symptoms lasted. So there's a lot of leeway to kind of play the game and sort of spin the story a little bit.
Yeah, it's something to certainly keep our eye on, and you hope for his sake that that he gets through the rest of the season healthy. But again, supposed to be back this week to take on the Bills. Dr. Todd, thanks so much for the time as always. We really do appreciate it, and enjoy the rest of your week. We'll do our weekly SOS house call again next week.
Appreciate it. Have a great day, guys.
All right, you as well. Dr. Todd Battaglia joining us here on the show. And with that, we will take a timeout. We'll open it up to the phone lines the rest of the way here in hour number 1, 315-437-7644. And now is the time to call. We got 3 interviews lined up in hour number 2. We're back after this on ESPN Radio.